Good morning.
Morning.
Good afternoon. Good evening. My name is Malka Stromer
And I'm Janine Noble.
from Sound Sports Imaging. Today we are going to be doing our webinar on the elbow, wrist, and hand. Again, as usual, if you have any questions, please try to hold those to the end and we'd be happy to answer them. And we'll get started.
All right, elbow, wrist, and hand. Again, like some of the other extremities that we've looked at, you want to follow a guideline for this. Mine happens to be lateral, posterior, medial, and anterior. And lateral, we're going to look at the common extensor tendon, the radial-collateral ligament. Posterior, the distal triceps and the olecranon bursa. On the medial side, which is, I call it the fun side, you have the ulnar collateral ligament, the common flexor tendon, and the ulnar nerve. And with any luck, Malka will have a subluxing ulnar nerve for you to see. And then anteriorly, we look at the distal biceps. There are other things that can be viewed in there, but that gives you a quick overview of what's going on. In the wrist, we're going to stick with the lateral wrist for deeper veins for the first extensor compartment, the carpal tunnel, and then just kind of look at the wrist joint. And then in fingers, we'll just go over what the flexor tendons look like. All right, we're going to start with right through here. We're going to share the screen with you. And hope everybody had a good Memorial Day weekend. I know we did. The weather here is better than it's been in forever, so we all enjoyed it. Move this out of the way. Go do a full screen. All righty. I like to do the elbow. Now you can, if you want, the elbow can be done supine. You can do it sideline. You can do it however you want. I like to do it seated with the elbow in this position, slightly flexed, and you can see palm on the leg, on the thigh. This way you can get every bit of it without having to move the patient around too much. Notch will be proximal, so toward the head will be on the left side of the screen. And palpate where that radial head is and go right to it. Beautiful. I'm gonna decrease the gain a little bit. Oh, looks like Malka's been playing some tennis here.
Yesterday.
Ah, all righty. So on here we have the lateral epicondyle, capitellum, and radial head. Now these should be very smooth bones. And you may notice a little lack of smoothness in through here. Now Malka is an avid tennis player. She may not be very good, but she's really avid. And this is her dominant arm. Now the extensor tendon comes right into here and attaches. And you can see as I'm coming a little anterior, kind of scooping around and going posterior, it looks pretty darn good. Now I'm gonna just stabilize my hand here. I'm gonna have Malka do a pronation, supination with her wrist. And you can see the movement of the radial head. So if you wanted to, you could look for radial head fractures in there or impingement. But nice looking. Okay. Then relax. We're going to go posterior. Right through here. Olecranon, triceps tendon. This is the posterior elbow joint down in here. This is the little fat pad that's down in there. Joint effusions will show up in through here. The olecranon bursa is in this area. If it's there, you'll see it. If not, you won't. And it's pretty obvious if there's swelling to it. I mean, besides the fact you can visualize it. So I'm going to follow up through here. I'm going to go a little lateral, a little medial, or vice versa. And I'm going to do a short axis through here. Again, we have olecranon going toward the tip. And this is pretty cool because in this view, you can see the three heads of the triceps tendon. Again, we'll make sure our anisotropy by angling the transducer a little. 1, 2, 3 heads of the triceps. Looks good. On the medial side, and this can be tricky, and sometimes I'll use a second hand or finger to help stabilize this. Boom. Epicondyle, ulna, the space on the medial side is much smaller than it is on the lateral side. Here is the portion of the ulnar collateral ligament. If you've heard of Tommy John surgery, all the baseball, since we're in baseball season now, the ligament that they tend to tear with Tommy John surgery is the ulnar collateral. This one looks really good. Common flexor coming in right to here. So we'll just scan through there. Now, right along here is the ulnar nerve. But prefer to visualize this in a short axis view. If you palpate across the cubital tunnel and then just put the transducer across that tunnel, you will go right to, hopefully, where's your nerve, Malka? There it is. She has such a little nerve right through there, and you can see the sheath around it. Many times this will be pretty enlarged, but now, and this is the tricky part, I'm going to anchor myself here while she flexes. Go ahead and flex. Just bring it in. There you go. Slowly and back. And that nerve stays right where it's supposed to be. If you look on our Instagram page, Sound Sports Imaging, there's a really good image of a sublux or dislocating ulnar nerve. And it's kind of fun. We do it until the patient says it hurts, please stop. And you can relax. We'll wipe off some of this gel, which has a tendency to get everywhere. Anteriorly, the distal biceps tendon comes right along through here onto the radial head, right in there. And again, you can pronate, supinate to see that. And this all looks good. So her elbow looks great, picture perfect. We'll go down to the wrist and I'm gonna lower this a little. Okay, I'm gonna start with the lateral wrist, and lateral as in anatomical position. We are going to run just across, and I am just on the tendons in the extensor, first extensor compartment, and we'll see both of them moving through here. This is the lateral wrist joint down in there, but I'm gonna rotate, turn this 90 degrees, and here are the two tendons in the compartment. There's one and there's two. When there's fluid in through there, you'll see a lot of black. It's generally tenosynovitis. And de Quervain's is a tenosynovitis. Most of the time there is no tearing, it's just that, but you'll see those big black areas. And occasionally there'll be a third slip of one of the extensor tendons coming through here. But that looks good. And you'll recognize blood vessels over in here. You want to kind of stay away from those if you're dry needling or injecting. Going to go down now to the first CMC joint. So there is the metacarpal, the line up at the top. We're going to follow it up to the first CMC joint, and you can tell with movement. This is the most commonly arthritic joint in the body, so chances are you're going to be visualizing a lot of these. And to get an idea of if is there an effusion in through here. That looks pretty good. Okay, to carpal tunnel. One thing I like to do is to extend the wrist a little bit. We're going to go right to the crease.
Hard to come back after a long weekend, huh? Right.
And we are in the carpal bones at the bottom, and this is where another anisotropy. I am slightly rocking this, and I'm moving toward the palm to get the right angle. But here is the median nerve is right up here. Malka's is kind of small. I'm going to show you mine just because I happen to know that I have a really large median nerve. Do you want to point that out, Malka? The arrow's right over there. You can see the sheath around that. As I move my hand, I'm flexing. And you can see the nerve stays there. There are no symptoms, but you can see the brighter white, the hyperechoic sheath around the nerve. Okay. And if you can wiggle the individual fingers, if you push the thumb, it actually points toward the nerve, and that'll help you locate it too. The other way I like to think of in trying to locate it to begin with is the nerve is right along the line of the third finger, and that'll help you get right to it. And then if you rotate into a long axis view, and this is just to wow the patients, you can see the flexor tendons moving, and then the nerve is right at the top of the screen. Yep, sheath right through there. One thing that always surprises, I think, almost everybody that demos that we show this to, the surprise is how superficial the median nerve is. When they're learning injections, when providers are learning injections, they always tell them to take the needle in until you hit bone and back off. But in reality, the nerve is very close to the skin surface. Okay, on the dorsal wrist, you much look at the joint. Okay, so go ahead and wiggle your fingers. You can see the joint space looks good. There's no real effusions in through there. Okay, and then we'll go to a short axis. And you can see all the different, go ahead and wiggle your fingers. You can see the different tendons in through there. And again, some of this, you can get very, very detailed with this. This is just a basic kind of exam of the common things that you'll see. And then on the medial wrist, more gel. On the medial wrist, we are going to look at the extensor carpi ulnaris right in through here. This is the joint, and the TFCC snugs right along there. All right, down in the fingers, we'll look for things like trigger finger on the A1 pulley. And again, Malka is like picture perfect here, so we're going to have a hard time finding that. But go ahead and flex and extend your fingers. You can see the flexor tendon, the two of them right through here. The A1 pulley is going to be right in through here. So if it's swollen, it'll look quite a bit thicker up in through there. And you'll see a catch. Fibromas tend to be in the palm, and they will show up as big, solid white areas in through there. If there are cysts, ganglion cysts tend to be in the wrist joint. You'll see them arising out of the joint and be big, black, anechoic cysts in through here. They also will arise from the volar surface, many times from near the radial artery. And this is good information for a physician, because they'll need to know if that cyst is running in and around the artery or if it's completely separated from that. And that is a hand, wrist, elbow exam. Yeah, we've got her so completely gooed up right now. But thank you very much for joining us. As always, if you have any questions, please contact us at info@soundsportsimaging.com.
And you can also visit our website at www.soundsportsimaging.com. And as always, we provide solutions to all your ultrasound needs. Hope you have a great day.
Thank you. Bye.